Everyone, it's me and Tom again, so Lyndsey and Tom, and today we're talking about liver cancer. So what is liver cancer? So basically it's a cancer that is found anywhere in the liver. So your liver is basically at the top right side of your tummy, and obviously it's a large organ. It's basically the organ that helps you digest your food, and it also removes any toxins from your body. And the reason that liver cancer is so important and having awareness around this is if it is found late, it's really hard to treat. So obviously to be able to determine it, we need to look at the symptoms. So you need to be aware of what you're looking for. Unfortunately, you may not have any symptoms, or they might be really tricky to spot. They're basically primary liver cancer and secondary. So primary liver cancer is one that obviously starts in the liver, and secondary is one that kind of spreads from another part of the body. And the symptoms are the same, regardless of whether you have primary or secondary liver cancer. If you do have symptoms, they can include your skin, or the kind of white bit in your eye turning yellow. You may have itchy skin, or your pee could be darker, and then your poo could be paler. So kind of the contrast there. You kind of may lose your appetite, or start losing weight without actually meaning to lose weight. Again, kind of having no energy and feeling tired, and generally just feeling unwell really, and kind of having flu-like symptoms. And a kind of another important one is having kind of a lump on the right side of your tummy. So other symptoms can then begin to kind of affect your digestion, and as a result of this, you might kind of begin to feel sick, or actually being sick, and again, kind of that pain on the top right side of your tummy, or kind of in the right hand side of your shoulder. And again, if you are having problems with your digestion, have symptoms of indigestion, feeling full very quickly when you begin to eat, and kind of a very swollen tummy, which isn't a result of you eating. So kind of looking at the groups that are more likely to get liver cancer, so basically anyone can get primary liver cancer, and it's not always clear what causes it. And then the secondary liver cancer basically is a spread from another part of your body. So again, it will be kind of the causes from that type of cancer. However, you are more likely to get it if you're over the age of 60, and it is most common in people over the age of 65, so that kind of older age group. You're more likely to get it if you're a man than being a woman, but again, anyone can get it. And if you have certain medical conditions such as hepatitis, gallstones, diabetes, or kind of a parasite in the liver, and HIV, you are more likely to get this. And again, if you've kind of got any close kind of relatives, so brothers, sisters, parents, who have primary liver cancer, again, you're a more likely case to get this. So what is the testing for it? So primarily you can have a blood test. There's then kind of all the scans out there, so ultrasound, CT scans, MRIs, all of these will kind of pick up signs of liver cancer. And then kind of if you begin to think you have it, they can kind of do more kind of local samples, so a sample of the cells from the liver, and then lastly kind of a PET scan. Again, you won't have all these tests necessarily. It could be that you're looking for kind of other signs or other types of cancer, so they kind of just cover all areas really. And these tests are also kind of beneficial as they can kind of look for other kind of signs of any other kind of diseases, so things with your pancreas or your gallbladder. So getting your results, so it can take a fair bit of time, so several weeks to get your results, so really do try not to worry. If your results take a long time, it doesn't necessarily mean, and it definitely doesn't mean that there's something wrong. It does just take this time scale, but you can speak to your GP or hospital if you're worried, and they should be able to give you a kind of an update and some time scales of when those results will be back. And then when the results are in, a specialist will explain exactly what they mean, and what will happen next. And we do recommend that if you can, and bring someone with you for support, just to kind of have that support network with you. So what happens if you're told you have liver cancer, Tom?
Yes, obviously, receiving this kind of information can be extremely overwhelming and anxious, and a little bit depressing, of course. So, as you mentioned, it really can help to bring someone along with you to your appointments. Obviously, a group of specialists will look after you throughout the whole period, diagnosis, treatment, and way past that as well. There are lots of stuff on the NHS website as well, which will give you different access to forums and support groups for individuals who are going through quite literally the exact same thing as you. So really kind of just using those NHS and the different specialists who will offer you that support and that contact during the whole course of everything, really.
So like with all cancers, there's quite a lot of treatment options. So tell us a bit about this, Tom.
Yeah, absolutely. So, I mean, liver cancer is often treatable. It can be difficult to treat, but it is treatable. And it will obviously depend on certain things, like whether it is primary or secondary cancer. Liver cancer, obviously the spread is slightly different. The size of it and the type, depending on what grade it is or where the actual cancer is. If it has spread, if it has spread beyond the liver, then you start to go up a grade. And obviously, the higher the grade, the more severe the actual cancer is. Your general health, and if you're relatively fit, then usually your body and your immune system will be able to fight back as much as possible. But staying healthy is obviously a massive part of this, and being healthy will really kind of help your chances of fighting this back as well. And of course, it might include surgery, chemotherapy, radiotherapy to destroy the cancer in a thermal ablation as well. So targeted medicine can obviously be used in the form of that too. Yeah, surgery, obviously, as we mentioned, is one of the methods. If it is found early, as we mentioned, they can usually remove the whole thing there and then. If it has spread, sometimes they can only take a portion of it, or sometimes the best form is chemotherapy. But the surgeon will essentially remove part or all of it. Once it's been removed, it will place your liver with a donated one, and you'll essentially start your recovery. Specialists will, of course, look after you during that process as well. Your second one is your chemotherapy, as we mentioned. So usually the medicine, which will essentially kill the cancer. Again, with regards to all of these treatments, depending on how early you can find this, gives you more likelihood of really killing the cancer and fighting back to at least reduce it and be within regression. So using medicine to strengthen the blood vessels of the cancer, and it aims to stop the cancer from growing, which is called the immobilization. And it just stops, almost immobilizes that cancer from growing any longer or bigger. Using heat, which is where we said the thermal ablation. So thermal ablation is essentially using an electrical current, and it essentially cauterizes or burns off and destroys the cancer. As the slide says, quite simply, it microwaves the cancer. So if that makes a bit more sense to you, essentially just really burns off that cancer. And you may have to obviously have that thermal ablation to treat the liver cancer if you're not able to have the surgery because you're unwell, because you're older than a certain age, or because your body physically cannot any forms of stress. Treatment with the targeted medicines, as we mentioned, with the chemotherapy or certain medications, will help you to stop that from growing. You might have to have the treatment with the targeted medicines if you can't have the surgery, as we said, if you're unwell, or if it's spread to other parts of the body. And if you've got liver cancer and it's not only affected the liver cancer or the liver, getting the liver removed or parts of it removed won't necessarily get rid of it, as it's already spread to certain areas. So the chemotherapy would be a better treatment for this.
So you can't always prevent liver cancer, can you? But you can make kind of changes to lower your chances of getting it.
Absolutely. So lowering those chances will be things like, as we mentioned before, the healthier lifestyle, being a healthier way, cutting down the alcohol, avoiding more than 14 units of alcohol a week, trying to not smoke, and regularly exercising 3, 4, 5 times a week. Whatever it is, it will help, even if it's going for a brisk walk. Now, obviously, wearing protective clothes and masks if you are working on a job where you're exposed to certain harmful chemicals will, of course, reduce that spread and also obviously prevent you from getting it in the first place. and avoiding infection with the hepatitis B and C viruses. And up to 80% of primary cancers worldwide are caused through these infections, so they're very, very common. And people do get infected through the physical contact with other bodily fluids with the person who has that similar virus.
So there may be cases where the liver cancer cannot be treated. So what happens if you're told that it cannot be cured?
Yeah, absolutely. So usually you'll be told this within a GP's office, and this is where we say that it is really good to go with somebody and make sure there's somebody there to support you. Finding it out is not the best news that you're going to get, but you will be referred to a specialist. You'll have a team of doctors and nurses called the palliative care treatment symptom control team, and they'll essentially work with you to manage your symptoms, make you feel more comfortable. Really try and make sure that you will get the best out of everything that you do for however long that takes. And obviously, please remember that this is very, very, very rare. So, being in that position where that cancer cannot be treated, as we mentioned, is very, 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 very rare because it's such a curable cancer, and usually can be found very, very early if everybody's looking after their bodies and making sure they're keeping checks on themselves. And once they've made that distinction and they've found the cancer, it will be treated. So it is rare, but it does happen as well. So having that treatment and the charities that can support you in times of that kind of crisis, not only those charities but also those forums and those groups, as we mentioned before, which will, those support groups will really, really help you to connect with people who are in a very similar situation with you, and help you through that difficult time. So based on that, you've also got your certain support centres. So Maggie Centre, you've got Cancer Research UK, Mary Curie, and also Macmillan Cancer Support. So all of the links, all of the websites, phone numbers, everything that you need will be on this slide. So you'll have access to this. You'll be able to go on and get the support that you need to really help and progress. So thanks a lot for listening, guys. That we are done.
Cheers, Tom. So yeah, a lot of useful information there, and some good support links. So please do use them. And once again, let us know if you've got any questions.